Okay, do you want us to go ahead and start?
Sure, let's give it a go. Well, thank you for taking the time to join us this afternoon. My name is Ruby Robinson, and I'm a vice president with the Jewish Community Relations Council, AJC, or in short, JCRC, AJC. The JCRC is an organization that represents the Jewish community in Israel and Metro Detroit and beyond, and works to establish and foster collaborative relationships both within and with the Jewish community at large through advocacy, activism, education to ensure the interests and values of the Detroit Jewish community and Israel are communicated in a fair and impartial manner. Today, we are very lucky to have you on this webinar for you to learn about some of the challenges that non-citizens are facing during the time of the coronavirus. This is part of our ongoing series about vulnerable populations. So far, we've had programs exploring the challenges that homeless individuals and those who are housing insecure, the Jewish community at large, and those who are both incarcerated and working in prisons have been experiencing over the past few weeks and will probably continue to experience for some time. So in a moment, I'm going to introduce our presenter, Christine Sauve from Welcoming Michigan. I want to remind you that if you do have questions, you can put them in the question and answer box or in the chat box, and we'll intersperse them as they come in. We'll also have a little bit of time at the end to get your questions answered. If you are watching on Facebook, just put your comments in the rolling, put your comments in and we'll ask the questions in turn as well. So it is my pleasure again to introduce Christine Sauve of Welcoming Michigan. Christine is the director of Welcoming Michigan, and Welcoming Michigan is a part of the Michigan Immigrant Rights Center, Christine, or MERC. Christine joined MERC in 2011 and is based in Detroit. As the Welcoming Michigan director, Christine leads MERC's statewide efforts, immigrant inclusion efforts. Through dialogue, shared meals, education, and training, Christine works to foster mutual respect and understanding among community members. She also supports and collaborates with Michigan's welcoming cities and counties, helping local leaders implement more immigrant-friendly policies and practices. In 2013, she was one of 10 national leaders honored by the White House as a champion of change for her effort to advance immigrant inclusion. She previously served as a Peace Corps volunteer in Mauritania and Senegal, and is a member of the National Association of Social Workers. She's a graduate of the New Detroit Multicultural Leadership Program, Detroit Equity Action Lab, Welcome Communities Transatlantic Exchange, and the Detroit Revitalization Fellows. Christine received her MSW and undergraduate degrees from the University of Michigan. She's happy to call Detroit home and to contribute to the creation of more welcoming communities across the state. Christine, take it away.
Thanks, Ruby. Thank you for such the kind introduction. Thanks for everyone who is watching online and for joining us to learn more about this topic, how the pandemic is affecting our immigrant communities. I'm going to go ahead and share my screen here so that I can share some slides with you. So hopefully everyone can see that. Great, okay. So as Ruby said, Welcoming Michigan is a project of MERC, and MERC is a statewide nonprofit legal resource center for immigrant communities with offices across the state. So I'm based in Detroit, but I partner with communities around the state. And that includes partnering with local community-based organizations like JCRC and other community-based organizations that are part of local groups focused on increasing equity and promoting inclusion in their communities. And we also partner with local governments as well, so a network of welcoming cities and counties. And we're a part of Welcoming America. So I want to start off, if some of you know how to use the features where you can, let's see if you can clap your hands. No? Okay. I may not be able to see all of you, but if you are an immigrant, you could raise your hand. If you are the child of an immigrant, raise your hand. Or if you have a grandparent or an ancestor that came to the US from another country, raise your hand. And I go through that exercise just to show that we all have a connection to the migration experience. And it's important to think about that and call on that connection when we're talking about how to support our immigrant and refugee friends and neighbors today. So as this series has highlighted, some members of our communities are more vulnerable than others during times of crisis, or specifically during a health crisis. And some of this vulnerability may be health related, and indeed for low-income immigrants of color, they experience health disparities that put them at greater risk. But there's also other social, cultural, and structural factors that play into that vulnerability, such as living in areas with high pollution or asthma rates, living in dense communities, needing to rely on public transportation, having limited internet access, or working in jobs that are on the front lines as nursing home aides or food service workers. And then additionally, some members of our communities are more vulnerable due to specific decisions of our policymakers and our collective society. So for example, undocumented immigrants have been largely excluded from our healthcare system, and so they may have greater health needs. And you may wonder, well, why is the system like this? And unfortunately, the answer is that we, again, as a society, have built the system this way. So over generations, we have defined citizenship in a very narrow way, and specifically in racial terms. So our immigration and welfare laws were designed to be punitive, and the effect is that low-income immigrant communities of color have restricted access to really the most basic things that we need to survive, and certainly need in a pandemic. So healthcare, food, economic security, being recognized as a person before the law, and having safe workplaces where you can earn a living. So these policies come from a complex web of laws and regulations, but they're not accidents, they're not omissions, and they're not unintended consequences. Defining citizenship over the years in racial terms and limiting access to rights and privileges and programs has been a key aspect of structural racism. So our public policies, our institutional practices, even cultural representations, all of these norms work together in ways that reinforce and perpetuate racial inequity. And then this results in greater power and privilege for white Americans and more negative impacts for Americans of color. So as many have pointed out, this pandemic gives us an opportunity to redesign the systems we depend on, and to do so with more attention to that disparate impact. And so like other vulnerable populations, the pandemic will hit low-income immigrant communities harder, and specifically immigrants without status, but it won't hit them harder the way a tornado might hit one community harder than a neighboring community. It will hit harder because that's how the system was designed to work. So staying at the big picture level, I just want to remind folks that immigrants and refugees are not a monolithic group, and all the markers of identity that we find in the community at large, we find in immigrant and refugee communities. So, plus the addition of immigration status. So you have folks across the age spectrum, racial and ethnic backgrounds, varying degrees of wealth or poverty, different sexualities and genders, varying health and abilities, and so on. And so we could look at this pandemic and how it's affecting people in each of those categories. For example, LGBT immigrants, immigrant children, immigrants facing domestic violence, Asian immigrants. But for the purpose of this presentation, we're going to take a few key issues that are unique to folks based on immigration status, and a little bit on English language proficiency. But just so you know, foreign-born folks may face bias due to any one of their identity characteristics. For example, folks with disabilities might face additional stigma, certainly accessing healthcare, and Asian American community members may be experiencing heightened bias at this time. So language access, one of the first things to note in this pandemic is how to get critical information out in a time of crisis to our immigrant and refugee neighbors. And sadly, this tends to be slower due to a lack of infrastructure built for translating and interpreting information for members of our communities who might not be proficient in English. So over the years, we, along with other advocates, have been encouraging institutions and local governments to invest in this infrastructure because every resident deserves to have access to basic services and information. And then also, of course, it's an important way to demonstrate that we care about the full inclusion of all of our community members. But additionally, the Civil Rights Act of 1964, Title VI, and then subsequent regulations, they all work to ensure that no person should be subjected to discrimination on the basis of race, color, or national origin, and for programs that receive federal financial assistance specifically. So there's also a legal imperative to making sure we have language access in place. So this has always been a concern and an issue, but like many things during a pandemic, it's heightened. And so many local, state, and federal government entities that haven't invested in language access are struggling to be able to get critical health information out quickly and get it translated in different languages. So each time a new restriction or health guidance is released, that has to be translated quickly and simultaneously into other languages and posted at the same place the English versions are, and this has been difficult. So in communities that have not done that investment in language access services, it's mostly falling to immigrant advocates, and immigrant community advocates are already overwhelmed trying to serve members of the community, so it's a big lift. And then that brings up another important factor in a pandemic when you're trying to serve any vulnerable community, and that's trust. So for immigrant and refugee communities who already might distrust local and state governments due to the many ways that their communities are often targeted previous to the pandemic, you know, having trusted messengers and working with community advocates that the community can look to and have trust in the veracity of their message is really important. And so some of that work, if it's done well before a pandemic or crisis, really helps when the crisis hits. Some of this is happening locally in groups like the local Welcoming Oakland County group, of which JCRC AJC Detroit is a part of that group. And then in Detroit, among the Detroit Immigration Task Force. So folks have been working on that and building trust with the community and with local government. And then advocates and nonprofit organizations have also done a great job at this time coming together and responding to provide information. So I wanted to highlight the weekly COVID 313 community town halls. If you haven't seen those, they're on Detroit Public Television's Facebook page. And those are weekly on Fridays, and so you can catch up with a lot of important information there. And so one of the positives has been seeing communities come together during this time. And if there was already trust built there, it happens much faster for them to be able to get information out. So I'm going to move on to talk about some major structural aspects of the following topics, but keep in mind here that there's also social and cultural factors that might compound the isolation and economic stress experienced by low-income immigrants of color, especially folks without status. So on the topic of healthcare, the Families First Act provides funding for COVID-19 testing, so that's good news, and that's for anyone who's uninsured. So immigrants can access services at federally qualified health centers regardless of their immigration status. That's one of the few places that if you're undocumented, you can go for medical care. However, One of the things we found, especially in Detroit, is that a lot of the FQHCs are overwhelmed. So we do recommend that you call first. We've tried to develop a list and update that as the situation changes, and we have that posted online. We'll have the link at the end of the presentation. Undocumented immigrants and non-citizens who've had green cards for less than 5 years are only eligible for emergency services only Medicaid, so they're not eligible for regular Medicaid. But we do have some good news on that point. Just yesterday, actually, thanks to some advocacy from Merck and the Michigan League for Public Policy, MDHHS just announced that ESO Medicaid, emergency services only Medicaid, would cover all costs associated with COVID-19 testing and treatment. So that's a small bright spot. And then testing is also available for essential workers, many of whom are immigrants. So undocumented immigrants were already largely excluded from our healthcare system prior to the pandemic. They were already ineligible for healthcare subsidies under the Affordable Care Act and prohibited from purchasing unsubsidized health coverage on the ACA. So, and they were already excluded from regular Medicaid. But I do want to point out that it doesn't have to be this way. This is something that we could work to change at the federal level. It might be hard, but it is possible. And at the state level, 6 states are using state-only funds to cover income-eligible children regardless of immigration status. So that's something that Michigan could also do. And in California, they've expanded that even up to the age of 25, so regardless of immigration status. So we can change how the system works. And then I do want to note, there's been a new public charge rule that took effect in February. And so that changes who is eligible for a green card. And I mentioned this in relation to healthcare because some folks are concerned if they access healthcare, how will it affect a public charge determination? So just a short recap on what public charge is. So some people who apply for a green card or a visa to the US, they have to pass what's known as the public charge test. And that looks at whether the person is likely to use certain government services in the future. And in making this determination, immigration officials look at all the person's circumstances, including their age, their income, their health, their education, their skills, including their English language skills. And they look at the sponsor's affidavit of support. And they can also consider whether a person has used certain public programs. So the new public charge test does not apply to all immigrants. And so we do recommend, getting advice from an immigration attorney for specific situations. But the new rule considers SNAP or food stamps. It now considers federal public housing and Section 8 assistance, Medicaid, except for those emergency services, and cash assistance, so things like TANF. So it doesn't include WIC, CHIP, school lunches, food banks, shelters, state or local healthcare centers. So that is still not considered in the public charge test. And it doesn't affect a large number of immigrants. It's a relatively small pool of folks that are affected. And so for most undocumented folks, this is not a consideration. It's for a small select group of people that were looking to get a green card. So the good news here is that USCIS posted a clarification saying that they would not consider testing, treatment, or care related to COVID-19 as part of a public charge determination. However, the issue here, even though it affects a small number of immigrants, is that the rule has created fears and a chilling effect with families who are afraid of accessing any services. And so even if it's something they're eligible for, even if it's not even if it's not a government program, so even going to a food bank has folks afraid. So we are trying to kind of clarify what's in the determination and what's not considered.
So, Christine, if I may, and this returns back to what you were saying earlier about information not being shared in multiple languages, that there's kind of incomplete information that goes out there, and that just the overall chilling effect of public charge really has affected certain individuals who are eligible for basic services and assistance from accessing those, especially if they have young children. In general, most non-citizens are ineligible for those benefits anyway. So even if they were to apply, they would have been denied, such as like food stamps, Medicaid, et cetera. If you do have questions, again, if you were not here at the very beginning of the webinar, just feel free to put your questions in the question and answer box, in the chat, or in the comments box on Facebook. Sorry. Keep going.
Thanks for that, Ruby. Yep. So now I will talk a little bit about the economic assistance. So the Coronavirus Aid, Relief, and Economic Safety Act, the CARES Act, it provides critical unemployment assistance, but however, a lot of the benefit will not be seen by immigrant families, especially mixed status families and undocumented folks. So unauthorized workers, so those folks are not eligible for unemployment insurance, even though many of them pay employer contributions and work in high-risk, low-wage jobs. Most non-citizens who are work authorized, they will qualify for unemployment insurance, so that is a bright spot. That includes DACA, TPS, asylees, refugees, folks with SIJS, and a couple other categories. They might struggle, however, with providing the required proofs. And then individuals must provide proof of employment authorization to meet all the eligibility requirements, and farm workers may be eligible. So they have to report all their earnings from all their jobs in the last 15 months, including from other states. And folks can apply online. We've heard a lot of struggles from folks, again, who may not be proficient in English, having trouble with the system. There's been a couple guides created in other languages, and again, we have links to those at the end of the presentation. And
Christine, a question about both that and then the health information about getting testing and getting treatment. How is that being communicated? Is it being done through like new media or ethnic media? Are states taking the lead and sharing this and putting together materials, or is it kind of a pretty large scale effort of trying to get as much information out as possible?
In this crisis moment, I'll say it's kind of an all hands on deck approach. So the state government is providing information, not so much on the healthcare information. I have seen them doing more informational guides, for example, on how to access unemployment insurance. Sometimes, again, it takes a while for those to be translated into other languages, but then once they are, they're all posted in a section on the Michigan coronavirus website, and there's a section for other languages. Sometimes it's really it falls to nonprofits or immigrant or ethnic associations to kind of do additional like handouts that really walk people through it in a more detailed fashion. And then we've seen a lot of folks, advocates, make videos to help people, because some of the documents are kind of dense in describing it. So really, I think everyone's pitching in. In terms of ethnic media, I don't know that I've seen a ton, but I have seen features here and there. So I think folks, again, are trying to get the word out. I can't say too much more about how much I've seen in ethnic media, though.
Great. I assume ethnic media, like other media, is struggling at this time. So alternative means probably is the more appropriate way to disseminate this information than through what would traditionally go through ethnic media.
And I've seen local governments stepping up too. So either reposting information that was created by the state or creating additional guides and trying to do it in different languages. The city of Detroit is a place that's invested in their language access, and so they've been producing more information in the top 3 languages in the city. So that's been helpful. Okay, I'm going to talk a little bit about the recovery rebate, or what some folks refer to as the pandemic stimulus checks. And so for the vast majority of unauthorized immigrants, except for those who had work authorization, and that does include DACA and TPS folks, the vast majority of unauthorized immigrants are excluded from this benefit. Including those who filed taxes using an IRS issued ITIN, an individual tax identification number. So the CARES Act also excludes from cash payments anyone who's filing jointly with a person who uses an ITIN, even if that person is a US citizen or a green card holder with a social security number. So this means that there's families where even if one member files using an ITIN, the entire family is rendered ineligible from receiving the payment. The Migration Policy Institute just came out with estimates that 15.4 million people in mixed status families are excluded from this, including 3.7 million children who are US citizens or green card holders of immigrant parents. So there's several lawsuits right now that were filed on behalf of mixed status couples and from undocumented parents on behalf of their US citizen child. So we'll be watching to see how that turns out. On the note related to unemployment and recovery rebate checks, will those be considered a public charge? The recovery rebate checks and unemployment insurance will not count for public charge purposes, again, so that's good news. However, having a low income or having a history of unemployment could be a negative factor in a public charge determination. We want to get the word out about pandemic EBT. So as part of the Families First Act, pandemic EBT is food benefits for families that received free or reduced school meals. And so this is automatically being sent to families across Michigan. You don't have to apply or sign up for anything. It's going out to anyone who was in a school receiving these school meals, as well as those not currently enrolled in the program. So some folks might have been surprised to get it because they weren't currently enrolled in the food program. And so there's no citizenship or immigration status requirement. They're not looking at that. And there's no public charge consequence to receiving this. So this is just extra help for folks who received free school meals. And it comes in a card that folks can use just like their regular food EBT cards. A note for small businesses and international students. I don't have a lot of detailed information on these topics, but many immigrant-owned businesses were eligible but had difficulty accessing the Paycheck Protection Program. Folks like Global Detroit and a network of other providers were trying to help people apply and work through the program and the application. There's other resources there for small business owners in lots of different languages. So I just want to point folks in that direction, and some additional handouts that they created for international students, if that might apply to someone you know. I want to talk briefly about state and local supplemental funds. So really, as I said before, undocumented community members have really been left out of these relief programs. So even though they pay into public benefit programs, they're ineligible for most of those. So that includes SNAP, regular Medicaid, TANF. But advocates in the My COVID Community Response Network are asking legislators to provide a state-funded cash rebate for those Michigan families that have been excluded, and those who pay their taxes with ITINs. So for example, in California, they secured $125 million to give one-time cash payments to undocumented immigrants. So that would be great if we could do that in Michigan as well. Stay tuned on that effort. There is some exciting news coming soon from the city of Detroit with a new fund of about 700 to 800 million to support, 700 to 800,000, it's under $1 million, to support undocumented folks in the city of Detroit. So they have to be Detroit residents. It's still being built, so stay tuned, we'll announce that. Yeah, so undocumented immigrants already contribute in federal and local taxes, and so we just want to highlight that they're not able to reap the benefits of the recovery rebates as other folks are who have paid into the system equally. And so as we've kind of highlighted so far, undocumented and mixed status families are really struggling. They're left out of the safety net completely. They're not eligible for unemployment insurance. They have limited access to medical care. They've been restricted from the recovery rebate. And so they're really struggling to pay for basic necessities, things like rent, utilities, diapers, food. And so a lot of our immigrant-led organizations have come together to help support the community. So I wanted to highlight a few of those fundraising efforts here. And really, if you're able, even if it's a small amount, we really would ask everyone to contribute to these funds. So some are strictly looking for monetary donations. Some are looking for volunteers or donation of supplies. I think you'll get the slides at the end of this, and so each of these has a link to the actual websites where you can donate or sign up to volunteer. Okay, I want to touch on immigration enforcement as well. So as you can imagine, detention centers are another one of those dangerous places where the virus can easily spread. So people are enclosed in confined spaces and shared spaces, and there were already alarming reports about health and safety conditions in detention centers and jails prior to the pandemic. So really this situation just heightens that concern. And really, you know, as we have here on the left, you know, the only purpose of civil immigration detention is to ensure that folks appear at their hearings. And so it would really be in the best interest of everyone if detainees could be released, especially if they have medical conditions that put them at higher risk. And so far, there's only been a few releases. ACLU has filed a class action lawsuit. Just yesterday, a judge ordered 2 detainees to be released from the Calhoun County Jail. In the St. Clair County Jail, 8 detainees plus 5 staff tested positive for COVID-19, and only 1 person was released. Another person was hospitalized. And then there's also, separately from the detention centers and jails, there's also 18 inmates and 16 staff tested positive in a privately run immigrant prison in Baldwin. So those are situations where, again, it's easy for the virus to spread, and you have folks that might have medical conditions that put them at higher risk. And then additionally, some other notes on immigration. So deportations have slowed because of limited travel, but that means longer stays in those high-risk jail settings. Non-detained hearings are postponed, but that means, you know, more years of waiting for the new court dates. Supervision appointments for those who have to check in with ICE are now done over the phone, but that can be chaotic in terms of communication, and then that creates additional anxieties for folks. The legal services and USCIS customer service are limited, but folks might have documents that continue to expire, and so those need to be renewed and filed. And I do want to mention there was a lot of news about the executive order that limits immigration for people outside the US, but it doesn't affect most of the folks that Merck serves. For example, it's more impacting folks outside the US who don't have immigrant visas yet. And then it impacts a number of family members of US citizens and permanent residents who were hoping to be reunited. It also shut down the diversity visa program and had an impact on employment-based immigration. And, you know, really it seemed like that order was just meant to primarily distract, divide, and scapegoat immigrants. I'm gonna move to the next topic about essential workers because I want to make sure we have time for questions at the end. So essential workers in the, you know, folks in our critical infrastructure include healthcare workers, farm workers, and that can be folks, you know, in the fields as well as dairy farms, folks working in food packaging and preparation, restaurant, carry-out workers, construction workers, and those providing childcare for those folks. And so if any of those workers have questions about whether or not they should be working, we do have a hotline for immigrant worker rights. And so we would encourage folks to call that number and ask their employer for a copy of or something in writing showing that they've been designated as a necessary worker. So in a time of crisis like this, we just have to be more watchful to make sure that folks' rights aren't being taken advantage of in a moment like this. Okay, and then for essential workers who might have to travel, this question came up. They might be stopped, for example, by a law enforcement officer. And we just want to remind folks that the stay-at-home order doesn't change an individual's rights when they're driving. Officers are not allowed to pull someone over just to ask if they're complying with the stay-at-home order. And folks still have the rights that they always have in those interactions. So you can ask why you're being pulled over, note the officer's name and badge number. You don't have to answer questions. It might also be helpful to have a letter, especially if folks might have limited English proficiency. A letter that helps explain that you are a critical infrastructure worker or you've been designated as an essential worker. Again, that is not a requirement and folks don't have to carry those documents. But if someone might have trouble with communication, it could be helpful to have that on hand. Also, again, the virus travels in confined spaces and the conditions in meatpacking facilities are really a prime place for the virus to spread. So at the JBS plant in Plainwell on the west side of Michigan, we had over 60 workers tested positive for COVID-19. There's been larger outbreaks at other places across the country. And so it's just essential that folks have the information they need to make sure that they have protection if they have been designated as a worker who must be in these spaces. So in general, personal protection equipment, PPE, may be required for certain types of businesses and for some workers. So for some examples, we have nurseries, garden stores, landscapers, groundskeepers. All these folks have to follow additional measures, including providing PPE, such as gloves, goggles, face shields, and face masks. There's a note specifically on face masks that all businesses and operations whose workers perform in person must, at a minimum, provide non-medical grade face coverings. And for workers who have any concerns or questions, or if they think their employer is not providing necessary protection, we encourage them to call MIOSHA. and there's the phone number there at the bottom. So these are two of the links that I mentioned they're basically links with lots of other links and lots of collected resources specifically for immigrant communities. And there's lots of different languages. There's information on health. There's information on immigrant rights and a host of other topics, how to access different supports and resources. So please check those out. And just a reminder, MERC has 2 phone numbers with questions about immigration and immigrant rights in general. Call the first number. And if you have specific questions about your rights as an immigrant worker, that's the second hotline. So I'm gonna pause there. I've talked a lot. And I wanna pause there to see if we have any questions.
And again, if you have questions, put them in the comment box or the chat box or in the Facebook comment box as well. And while those come in, Christine, let me ask you a question. If people want to be able to help or support immigrants or organizations supporting or working with immigrants during this time period, where would you direct them?
Yeah, I would say you support any of the fundraisers that I had listed on the other slide, and we'll have those links for folks at the end, because really, again, for those communities, they're really left out, and I've heard firsthand the kinds of questions that are coming in, and as much help as can be provided for those families as possible, I think folks would really appreciate it. There's other ways to help in general. I wanted to mention these items. You can also follow MERC and Welcoming Michigan on Facebook and sign up for the newsletter here to stay abreast of the issues as they unfold. Also think about how you can help reduce barriers in programs that you're a part of. So for example, if you're helping, a food pantry, making sure that people aren't required to show certain kinds of identification. So if you need to know their name, or you could accept any kind of photo ID, not restricting it to, state issued or driver's licenses. Sometimes people default to driver's licenses when not everyone has a driver's license. And then keep contacting your elected officials. I know that might sound like a broken record request, but really to chip away and make change at these structural issues, it really does help. And the more that elected officials hear from their constituents, it helps us make change. So, and that's at the local, state, and federal level. So there might be a local effort to create a fund, for example, to support undocumented community members where you live. Or there might be a state-initiated effort to support immigrants in Michigan. So watch for opportunities to comment on those. And then you can also write a letter to the editor, for example, in your local paper on one of those issues and why you're supporting it. Also make sure you're providing referrals to folks who might need resources. So it could be something from one of those 2 links I had, the Welcoming COVID-19 or the Michigan Immigrant page. But there's also a lot of other immigrant service providers providing services all the time, and there might be something in your community that you could direct folks to. And you could also join the Michigan Coalition for Immigrant and Refugee Rights. And that's another space where folks can come together for advocacy. And so the website is mcirr.org. I would also add, help us build welcoming communities for the long term. So ensuring that activities include residents from all backgrounds. So if you don't see that happening already in your community, that's an opportunity for change. Helping build awareness of racism, bias, and trauma. A welcoming community is a place where we partner with community leaders, where we work with welcoming cities and counties, if you can help us create more inclusive spaces and policies. So again, thinking about language access, helping reduce barriers, training frontline staff. A lot of change can happen with equipping and training, the first person that clients might encounter. And then, joining the process of learning about issues related to immigration for the long term and working to build cultural humility, could be, among you and your friends or you and your staff and colleagues. So there's some ideas.
Those are great. And I think just to add to that, where you do see those barriers, as Christine mentioned, share that with others, share that with people and organizations and leaders who might be able to actually affect change. Like, it took 2 months nearly to get this change regarding emergency services only Medicaid to cover coronavirus testing and treatment in Michigan. But that's going to make a huge difference to the lives of many of the undocumented folks in Michigan, who also, on a daily basis as well, experience some real challenges, right? Many are only able to pay in cash. They don't have bank accounts, which means they cannot purchase anything from Amazon or online retailers because they don't have a credit card. So like, these are real barriers that exist every day for many of the non-citizens across the state and across the country. And as you think about what you can do and what those in your community can do to help each other and all of us through this pandemic, keep that in mind. And maybe there's a way that we can overcome that or create an efficiency somewhere else to get essential goods or services or support or relief to the more vulnerable populations, and some of the non-citizens are certainly among that.
And again, I know I already said it a couple times, but really those fundraisers to help local families, the needs are just so immense. So every day, the folks who are leading those sites are getting tons of calls from families that, are, how do I pay my rent this month? How do I pay the water bill? How do I pay the electricity? And
getting diapers and food and just critical things that, if you don't have a car, that even hamstrings you even more. Or if you don't have face masks, some people don't have reliable face masks. So again, whatever we can do to support those individuals and those fundraisers, please.
Yeah,
please do.
So like One Michigan, for example, is looking for donations of personal protective equipment. So face masks or cleaning supplies, gloves, that kind of thing. One of the other sites is looking for donations of diapers and then again, cash assistance. So they're looking for financial donations.
Okay, great. Well, I don't see any questions. I think that means, Christine, you answered everybody's question and anticipated all of them. So thank you very much. This recording will be saved and it will go out probably tomorrow along with the survey to those who participated. So if you can fill out that survey, we would greatly appreciate it. The recording will be available on the Facebook page and we will share the PowerPoint with you as well if you registered for this webinar.
Great, thanks everyone. Appreciate your support.
Thank you, Christine, and thank you all for joining us today.